مورنينج. اسمي منقذ منذر علي. اليوم هقدم سيمينار الأورال سيرجري بعنوان Assessment of Patients for Dental Implant. Part 1. Introduction. Now, when considering implant treatment for a particular case, the practitioner has to evaluate whether the oral implants are indicated for this particular cases in this particular situation within the framework of comprehensive construction. طبعا dental implant in the last decade has had a widely spread among practitioners due to the increased demand by the patients and advertisement by companies. Now we have to do patient assessment, obviously, for this procedure, and listen to his or her complaint, desire, and preferences. Of course, we do an extra and intra-oral examination and periodontal and restorative status of the remaining dentition. We use diagnostic aids, radiograph evaluation, panoramic evaluation, pre-apical and additional tomography, study cast, and of course we have to do a medical evaluation. Patient's history. A medical questionnaire will aid in the initial interview of the patient, which include the past and current diseases, the temporal and long-term medications, smoking status, and specific dietary features. Additional questionnaire addresses the age of any existing prosthesis. Now, the reason for tooth loss, of course, we have to know if it was caries, periodontal diseases, trauma, or others. This is an example of a case sheet that is used to take the medical history of patients. It has many sections, such as the general history, which we will ask the patient about his general health or whether he was being hospitalized before or not. We have the cardiovascular segment, which is concerning the heart, the pacemaker devices, whether it was existing or not, and the hypertension and whether it was controlled or not. We have the central nervous system, which is concerning the epilepsy and seizures. We have the respiratory systems. This section is considered about the tuberculosis and chronic bronchitis. Then we have the digestive system, about the stomachs and stomach ulcers, and whether he has the jaundice or hepatitis. This section also has an endocrine system, which mainly focuses on the diabetes, if he has if he's a diabetic or not, and if he is it a controlled or not. The hematogenic system also. Any anemias or any sickle cell anemias, any problem with the platelets or immunodeficiency diseases. Allergies, if he has any allergies of a certain drugs that can also affect our treatment procedures. Any kidney diseases. And if he has a kidney disease, does he go on dialysis? Because if he could have a risk at developing or getting infected by hepatitis, for example. In the next section, there is also the bone section, whether he has an arthritis or any inflammatory bone diseases. Others, such as chemopathy, or is he alcoholic, or does he chew tobacco, is he a smoker, not. Now, the contraindications. The contraindications for implant are rare. The absolute contraindications are rare, and mainly related to an increased risk of patients undergoing surgical procedure. For example, patients in poor general health, which could interfere with the surgical treatment. Now, we have the absolute indications. These are absolute indications, but also, temporary. They're not long-term life indication. As long as the cause is removed, we can proceed. such as the infectious diseases, the chemotherapy. We can do it after the treatment is done. The systemic biphosphonate medications, the renal osteodystrophia, and of course pregnancy. We have osteoporosis. This reduces the bone implant contact. Consider calcium substances, prolonged healing period, and avoid high torque level of abutment screw fixation. We have the uncontrolled diabetes. Of course, this will affect the healing, so we have to put it under control. Stasis of past chemotherapy. We said that you have to. It is an absolute contraindication, so you have to maybe consider using corticosteroids. The alcohol and the drug abuse have to be. This could affect the wound healing and can reduce the local vascularization of a particular area. History of aggressive periodontitis. This could mainly increase the chance of developing pre-implantitis. Now, we have a clinical examination. This mostly concerning the aesthetic of the face, such as the face proportion, the facial skeleton classification, whether it was normal, prognathic, or retrognathic, the classes, class 1, 2, 3. And also it concerns the facial symmetry. Now we have the intramaxillary relationship, whether it was a correct, reduced, or increased. Now, of course, the average is 2 to 4 millimeter of it. Here we have the incisal edge. It works with the lip line, a high lip line or long lip, which is 31 to 35 millimeter, will only show barely show the incisors. An average lip is a 21 to 25 millimeters long and exposes 2 millimeters of the incisal edge in the normal situation. And a short lip, which is 10 to 15 millimeters, shows about more than 4 millimeters are visible of the incisal edge, and possibly shows the attached gingiva. This pictures demonstrate the high, average, and long lip lines. Here we have the neurological tests for areas involving innervated by trigeminal nerve in a certain of any sensitive abnormalities, such as baseline assessment in cases of intraoperative nerve lesions. The TMJ movement in function, contraction, and hypertrophy of the facial muscular as an indicator of the parafunctional habit, together with an abrasion and wear faces of the occlusal surface. Now, treatment planning. Now, for treating a single tooth, we have to assess the case if this single missing tooth needs an implant or needs a crown, a bridge. Now, it is preferable to put an implant if the adjacent teeth are sound, if there is sufficient bone and soft tissue. It is unpreferable to put an implant, and preferable to put a bridge if the adjacent teeth are carious and needs recontouring and there is not a sufficient bone or soft tissue. Now, partial edentulous cases are major indication of implant. It helps in the retention, it helps in the free end situation when you don't have an abutment. Now, in the edentulous cases, now mostly the people who have a full edentulous arch going to implants, the causes of that vary. The first cause, they could in edentulous mandible, for instance, the majority of patients suffer from a poor retention of their existing dentures, so they need something that would be very stable, so they go to the implant. Others just don't accept the fact that they will go full edentulous, so they want an implant also. They don't want a removable. and these are some examples of the full edentulous implant cases. And thank you for your listening.